Good evening.
Good evening.
One more time. Good evening.
Good evening.
This is a very special occasion for us in more ways than one. First, it was scheduled for next week. So how everything was adjusted and all of you showing up tonight is amazing. Thank you for coming. We have a wonderful speaker tonight that we got to meet when he was a third year medical student from WVU. He came, he conquered, and he came back. He's board certified in internal medicine and infectious disease. He's been a former park ranger. He may tell you something about that later on. But we had wonderful times when he was a third year medical student, trying to keep him under control. And tonight he's going to talk to us about facts and myths of infectious disease. One of the things that we used to say back when he was a third year medical student, when I move, you move.
Just like that.
Dr. Simmons.
For those of you who don't know me, I am Matthew Simmons, and Dr. Brown, thank you very much for that introduction. I got the somewhat dubious pleasure of talking about facts and myths of infectious disease. I will warn you right offhand that some of the things that we're going to talk about are a little bit controversial. And so feel free to raise your hand and disagree with me. It makes me feel at home. Okay, so one of the things we're going to talk about is some common myths in infectious diseases and to discuss some of the common myths about some of the clinically relevant local infections. One of the things that's important as an infectious disease doctor is to make your talk very pertinent to the environment that you're in. I could talk about chikungunya fever, but unless you're from Vietnam, you don't care. I could talk about Ebola, I could talk about Chagas disease, I could talk about a lot of things, but they're not going to be important to you. So we're going to try to stick to the things that are going to influence your life, okay? So can anyone tell me what this is? It's sputum, okay? How many of you have seen this coughed up out of some source somewhere? And the first thing you thought was, I need an antibiotic, right? So this is one of the most common misconceptions of infectious disease, that almost all respiratory infections go through a phase where they need antibiotics, okay? And in fact, the truth is almost all respiratory infections go through a stage where the mucus turns green or darker. It really doesn't have anything to do with the fact that the infection is getting worse. It's produced by myeloperoxidase, which is a chemical that white blood cells make. And it actually means that your body is killing bacteria. That means your body's actually winning the war against it, not losing it. So we talk about, when physicians talk to patients about sputum production, that's one of the first things the doctors tell you. Well, if you start producing more sputum or you get your sputum changes color, call me, right? Everyone's heard that. But it doesn't necessarily mean that you need antibiotics. And in fact, almost every respiratory syndrome that you'll have, you'll produce some sputum at some time. And everyone knows that clear is okay, right? Clear is fine. This doesn't mean anything that's bad. Yellow, you start getting worried, and when it gets green, you call your doctor. That is the first myth, and if the mucus is green, it's time for antimicrobials. There are no studies that correlate color of mucus at all to severity of infection. And in fact, in patients who clinically are improving without antibiotics, if your sputum turns green, the fact that you don't have any fever, your shortness of breath is not worse, it's something you can just watch. It's not a very popular point of view, and in fact, one of my mentors, Dr. Cuckoo, used to say that somewhere out on the block somewhere, some doctor's having a Z-Pack party, handing out Z-Packs to everybody who has green sputum. So that's the first myth that we want to debunk, okay? This is the second, and that is fever means you need antibiotics. In fact, the vast majority of pathogens of the healthy human host are viral and not bacterial. The way that we distinguish that is that viral infections are these very diffuse, all over, I ache, I don't feel well, I have a fever, and it's not just one symptom. If you've ever had bacterial pneumonia, the symptom that you get is fever, but it follows this pain in your chest, congestion, increased sputum that may have turned green. So I'm going to contradict myself a little bit there, but no, really what I'm saying is that Fever is a natural reaction that the body produces in order to protect itself. Fever does not kill bacteria. That's another common misconception. The reason that your body raises its temperature is that white blood cells and proteins called cytokines, which fight infections, function better at higher temperatures. So actually, it's sort of a downregulation of your immune system when you're walking around at normal temperature. You increase your body temperature 1 degree, and all these cytokines replicate much faster, and so do white blood cells. So your body raises its temperature to kind of speed everything up and make sure that your immune system is supercharged. That's another reason that infectious disease physicians say, don't treat fevers. It actually counteracts what your body's trying to do. And it's one of the things I used to tell my patients all the time in clinic. Hundreds of thousands of years, your body has been producing fever. Why would it do something that would hurt you? Bacteria doesn't cause a fever. Your body's response to bacteria does. And fevers as high as 104 can be caused by viruses. So a fever does not mean you need antibiotics. It might mean you need it. And that's one of the common things that we're going to talk about tonight, is that there are no absolutes in medicine. If a doctor ever tells you never or always, quick, get up and run out of the room. Because there are no always and nevers in medicine. Okay? What you're looking at is a picture of sinuses. And it highlights our next topic, which is our next myth, which is sinus pain means you need antibiotics. And that is also not true. Sinus pain is caused by a difference in pressure between the outside world and the inside world. So when you're a baby, you don't have any sinuses, okay? As you grow, you develop sinuses in your head so that your head doesn't weigh 15 pounds. It's just empty parts in the bone to make your head lighter and to help equalize pressure. That's what it does. It's expansion and retraction of air inside these cells helps equalize the pressure so that when you go up in a plane, as you fly to Aruba, your head doesn't explode, okay? The pressure, the pain that you get in sinus infections is usually because the mucus is thick. And it doesn't necessarily mean that you're having an infection. It means that you're producing more mucus and that it's getting junked up with all these dead white blood cells that are fighting off bacteria. Decongestants can help this, and can ocean nasal spray, which is basically just salt water. Salt water constricts the blood vessels in the nose, which pulls away some of the pressure, opens the cavity up, and then you relieve some of that pressure in your head. And believe it or not, the best treatment for it is Tylenol or ibuprofen and not antibiotics. Antibiotics, outside of the specific indication of certain bacterial infections, increase your risk of a lot of other bad things that we'll talk about. And that would have been a video, but now it's just a giant white box with an X in it. So it can be as poignant and important as you would like it to be. But that video, what that video actually was showing a person coughing, okay? And it brings our next one, which is bronchitis requires antibiotics. If you're starting to see a recurrent theme in infectious disease, it's that my job is not to pick antibiotics, it's to stop antibiotics, okay? I tell my medical students, because medical students come to me and they're all ready to learn about antibiotics, and they say, what antibiotic do we need to use? And I say, I don't think you need to use any. And it always frustrates my medical students. They're like, you're not a very good ID doctor. You never pick out any antibiotics. But the reason is that antibiotics are relatively new kids on the block. And before that, the human population survived long enough to create them, okay? So yes, mortality was higher then, but it was also, we didn't have all these superbugs running around, which we'll talk a little bit about. And the problem that too much of a good thing is not a good thing. So the vast majority of bronchitis is caused by a virus. Has anyone had bronchitis? Raise your hand if you've had it. You feel really badly if you've had bronchitis. You're wheezy, your chest burns, you feel short of breath, you have a fever, okay? One of the indications for bronchitis is that you don't necessarily cough things up. And 90% of bronchitis are caused by viruses, and they're caused by a group of viruses called adenoviruses and rhinoviruses, which are the viruses of the common cold. Okay? Bronchitis happens when a person has a coarse cough, which sounds, the other name for it is a bovine cough. That sort of non-productive nagging, you've all heard somebody sitting behind you on a train or a bus who just coughed and coughed and coughed. That kind of a cough. and that patient does not have pneumonia. It is a diagnosis that does not include a focal infiltrate, which is an area of consolidation, or overall bronchitis probably accounts for the biggest number of inappropriate antimicrobial prescriptions out there. The number one antimicrobial prescribed for bronchitis is Z-Pak. How many of you have had a Z-Pak? Raise your hand if you've had a Z-Pak. Right, okay. How many of you have gotten it for bronchitis? There's a lot of people. Or sinus infections, that's another amazing thing. So myth number 4, bronchitis requires antibiotics. About 90% of bronchitises do not require antibiotics. The next one is, I'm immune to all but the strongest antibiotics. The reason that the goal of antibiotics is actually not to kill off all the bacteria. And in fact, antibiotics do not fix infections. Your body fixes infections. There's no medication that replaces the appropriate function of an intact immune system. What it does is interfere with bacterial replication or kill off the burden of them so that your body can do the rest of the work. And the reason that we know this is that people who don't have immune systems, patients who have certain types of leukemia, who get chemotherapy, who have no immune system for a period of time, don't get better from infections just with antibiotics, okay? So antibiotics help your body do what it was already going to do, okay? Stronger antibiotics are used when a person has just finished a course of weaker antibiotics, such as amoxicillin, which even though it's considered a weak antibiotic, is very good for most things that you need antibiotics for when you're walking around in the community. Azithromycin, Biaxin, some very specific upper respiratory type of infection antibiotics. If you have symptoms of a pneumonia or an infection after receiving one of these courses of antibiotics, the likelihood is that you have a resistant bacteria, and that may require stronger antibiotics, Avelox, Cipro, linezolid, things like that. But when you do this, remember you're killing off all the bacteria in your body in droves. And your body naturally is colonized with good bacteria that help you. Your gut, which are your intestines, have several 100,000 species of bacteria that help it do what it needs to do, digest foods, protect you from other infections. So when you take antibiotics, you kill off all those. And you get resistant organisms, which we're going to talk a little bit more about. The good news is that most healthy people, even if they take these antibiotics, that resistant organisms that are left that grow out only last for a couple of months, and then you get repopulated with a nice, healthy, friendly antibiotics. Another reason that a person might get stronger antibiotics is if they're physically frail, if they're very sick, if they have leukemia, things like that, or an infection appears especially serious, okay? So this next slide sums up flu shots. One of the biggest questions I get from physicians who call me is, who gets the flu shot? And it's easy. Just about everybody, okay? And before we launch into this, I know that this is not a very popular topic. People have very strong opinions about flu shots. So I'm going to try to address some of the more common myths about flu shots. The first one is the flu vaccine can give you the flu. How many of you have heard somebody say that? Okay. How many of you have said it? Okay. It's actually, flu vaccines only contain dead virus, and a dead virus can't infect you. Okay. Now, the caveat to that is that there is a live strain of virus which is heat tempered, which means that it can replicate in the areas of your body that have a lower temperature, but it's been genetically changed so that in the lower portions of your lung where temperatures are higher, it can't replicate. It's genetically impossible for it to replicate. So you can't get sick from something that is dead. There's no such thing as zombie flu. It's not going to come back from the dead and get you. What the mistake that people make is that a lot of the side effects of the vaccine can make you feel badly. But that's the common with all vaccines. How many of you have gotten a tetanus shot and the next day your arm hurts and you have a little low-grade fever and you're like, wow, I feel really bad. But you never said, I got tetanus from my tetanus shot. If that ever happens, run away. while the side effects of the vaccine tend to be a sore arm, in the past, symptoms felt like the flu, and that may have been because of some contaminants of the proteins that are left in the process of creating the vaccine. That's no longer true. Actually, currently, the United States government is pending approval on a vaccine that does not include any part of the virus, but just certain proteins on the shell. If that happens, there won't even be a virus. It'll just be proteins that we give. To flu season, the other reason is that people think that they get sick from the flu is that flu season occurs at the same time that rhinovirus season occurs, that adenovirus season occurs, that all these other viruses occur. And people say, you know what, I got the flu shot and I got the flu. But now actually, you got another virus that we can't vaccinate for. Or in the off chance that you got your vaccine, it takes 2 weeks to produce antibodies, and then you caught the flu, just really bad luck before you got antibodies for it. But the flu, and this is one thing that I want you to take away from this, the flu shot does not give you the flu. I'm the first person to get it every year at my hospital. The reason is that I gotta walk the walk and talk the talk, okay? So I promise you, I'm a wimp. I don't like to be sick, so I wouldn't take anything that was gonna make me sick, I promise. So the next one is a cartoon, Public Health Council, and this is a couple of years ago, the state of New Jersey required all children in preschools to have the flu shot because as young as age of 2 could get it, a certain vaccine. And it says, we're pretty sure he won't get autism, but we're positive he won't get the flu. And that brings up the next topic, which is another hot button, which is if you're young or healthy, you don't need to worry about getting the vaccine, okay? Because the reason, first of all, we should all get the seasonal flu vaccine. Number one is if you don't want to be sick, there's no reason to be sick. There's nothing natural about being sick, being good about being sick. The second thing is that influenza leaves a portal and damaged lungs open to other infections, okay? You wouldn't say, you know what? I'm gonna get a urinary tract infection because it's natural to get infections. You know what I mean? It doesn't make sense that you would allow yourself to get sick just because people used to get sick, okay? The other thing is if you have a small child at home or an older parent or a patient, someone that has a lot of health problems, you getting your flu shot actually protects them through a theory called herd immunity. Healthy people that walk around, remember a large portion of people who get the flu don't have significant symptoms. They have a little bit of a fever, a little bit of respiratory symptoms, and they say, ugh, I just don't feel good, I feel run down. And that's how your healthy immune system is taking care of it. But somebody else who's has other problems, who's diabetic, who has cancer, who is morbidly obese, who has COPD, could get it and it could kill them. So it's important that healthy people get the flu vaccine to protect people who are not healthy, okay? The next one is, this actually was released by an anti-vaccine group in the United States. When the mercury hits your bloodstream, vaccine. And it's the eighth myth, and this is one of the ones that drives ID doctors to distraction. Vaccines are dangerous. Vaccines have prevented more death since they're from preventable infectious diseases than any other intervention that physicians have come up with since the beginning and the inception of medicine. Vaccines are first level prevention, which means you don't get sick, so you don't have to be treated. It's much better than secondary prevention, which is you got sick and then we're going to treat the secondary outcomes of it. In the last couple of years, there's been this big movement of anti-vaccine. And you'll see it on the news, and there's Mothers Against Vaccination who say it's natural for your children to get mumps and it builds their immune system and makes them healthy. It's natural for your children to get measles. There's a disease state called SSPE, and it's something that occurs in people who have had measles. It's a fatal disease recurrence. Measles vaccine got rid of it. Okay, it doesn't occur in vaccinated people. Second of all, I always tell these mothers, would you let your child get smallpox? Oh no, not smallpox. Not smallpox. Well, smallpox was rid from the planet by a vaccine, one of the best vaccines that we have. And it was much less safe than the flu vaccine, okay? There is a chance that you can get smallpox from the smallpox vaccine, but no one was saying, oh, I don't want that. We're good. Okay. Some people believe there could be a link between vaccines and an ingredient called thimerosal, which is a mercury-containing preservative, in human developmental disorders like autism. There have been multiple studies that show no direct link between the use of vaccines and the development of autism. Now, I'm sure there's somebody out there that's going to refute that. That's fine. You're allowed to have that opinion. I'm telling you that the Infectious Disease Society of America has done research on it, and there's no direct link. There may be an associative, but it's not causative, okay? And that's a distinction that we need to make. However, like I said, there's no evidence of it. If you're still concerned, you should know that there are thimerosal-free flu vaccines available, and Berkeley Medical Center has been thimerosal-free since 2004. So also Berkeley County Health Department. So the major distributors that provide us the flu shot in this part of West Virginia do not have thimerosal, so it's not something you have to worry about. Okay? Tell me, is this a spider bite or a MRSA boil?
Yes.
Good answer. Very good answer. I can't tell you how many times people come into my office and say, I got a spider bite. Spider bites are rare. And why? I guess you could get one that looked like that. That is actually a MRSA boil. Okay? Myth number 9, if I have MRSA germs in or on my body, then I am infected. Okay? One of the things I want to talk to you about is colonization of bacteria. Right now, as you sit in these chairs, you are covered with bacteria. Bacteria outnumber us trillions to 1. Okay? They've been here before us. They'll be here after they get rid of us. But the fact that you have MRSA on your skin does not mean you need antibiotics, okay? If you would swab every person in this audience, at least 20% would have MRSA on their skin. And we'll subtract me because I'm a doctor, and it would still be 20%, okay? MRSA is no different than any other type of bacteria. It exists in the public. It's out there, and you may have it on your skin. The reason you don't know you don't have it is because you've never gotten sick from it. It's not the people that get sick from MRSA that say, oh, I wish I knew I had MRSA. It's the people that never get it that end up getting screened, and then you're like, well, what do I do with this? And I tell them, have you ever gotten sick from it? And they'll say, no. And I say, there's not really any good evidence, okay? Colonization does not require treatment, and those are words that you need to ask your doctor about if you find out that you have MRSA. Infection versus colonization, okay? Infection means a bacteria is actively fighting your body. Colonization means that you picked it up somewhere and it's just kind of hanging out on your skin, doing its own thing, while your immune system, and most importantly, the most important part of your immune system that protects you, your skin is keeping it at bay. So when I tell people, if you're worried about MRSA colonization, take good care of your skin. Don't worry about taking antibiotics. This is, if you've ever been in a hospital and you had MRSA colonization, it seems like you're an alien when you walk into, everybody comes in a yellow gown and gloves and a mask and booties and a hat, and then they strip it all off at the door and wash up with alcohol. But the truth of it, the next myth is MRSA is only contracted in hospitals. And if this were 1961, I would agree with you. But here's something we already know. Who's in hospitals? Sick people. Who's more likely to get colonized and infected with bad bugs? People in the hospital. But if anybody's watched the news, there's been multiple large sports groups that have had outbreaks of MRSA. People that are healthy who run 6 miles a day and eat nothing but protein and vegetables and lift weights and are never sick and have never been sick in a day in their life, and they get MRSA. You are as likely to pick up MRSA in Walmart as you are in my hospital, and probably less likely in my hospital because I keep it clean. Often the source of infection cannot be clearly determined, so that if you've even been in a hospital and you get discharged and you come back and you say, oh, I have MRSA, and that darn Dr. Simmons gave me MRSA because he kept me in the hospital for 10 days. And I'll smile and shake my head and say, no. The truth of it is that most people that when they get MRSA come into the hospital already sick with it. Okay? This next one points out the next fact, which is MRSA became a really big topic when it became widespread, so everyone thinks this is relatively new. It's actually not. The story of bacteria in man goes way back. Staph aureus, which is the type of staph that all MRSA is derived from. And I guess I should be a little bit more specific. MRSA stands for methicillin-resistant Staph aureus. So all Staph aureus is one species. There's just certain groups of it that studied harder and became resistant to certain antibiotics. And this is a really good slide because it shows you how the bugs are smarter than we are. Penicillin's discovered. We first used penicillin to treat Staph aureus. It becomes resistant to penicillin less than 10 years later. Okay? First case of MRSA is discovered in 1962. So this is not new. This is not a new thing. It's just become more widespread because in the last couple of years, everybody's on Facebook and Twitter and MySpace and Instagram and AOL, and everyone's sharing their story on YouTube about how I have MRSA, and there's a 10-minute long video about it. Everybody knows everybody's business. Okay? So MRSA is not something new. It's something that is new to us because we started talking about it, but it's not new. MRSA, and that's what I just want, this is the next myth, which is MRSA is a recent phenomenon, and we just talked about it. Hospital-acquired MRSA started in 1960, and community-acquired cases were first noticed in the mid to late 1990s, and they are actually found in high school wrestlers first. Okay? This next is, I love my normal flora, and this is a little nod to all the healthcare professionals out there. When you take an antibiotic, we talked a little bit earlier about how taking an antibiotic gets rid of all your normal flora that colonize your gut and your nose and your armpits and all these other parts of your body. And your body wants to be colonized because having bacteria there, if it can select its antibiotics, it's like the bodyguards. It's like, okay, there's MRSA here, but you know what? We've got Staph epidermidis that doesn't cause us to be sick and replicates really fast and just covers up the area, and it buys up all the property in our neighborhood, and then none of that MRSA can buy any property. So it's like a neighborhood watch kind of thing, okay? That brings up the next topic, which is myth 12, which is I need to take a lot of antibiotics for a long time to get C. diff. How many of you know what C. diff is? C. diff is Clostridium difficile. It's an anaerobic bacteria that lives in the gut of 5% of people normally and comes out to play when other bacteria get killed off. So you go to your doctor, and you don't have a very smart doctor. Your doctor's, he's an ID doctor. And you come in and you say, you know what, doctor, I have a chest cold and I have bronchitis. And he goes, you know what, I'm going to fix you right up. I'm going to write you a Z-Pack. And he writes you a Z-Pack, and you take 2 doses, and all of a sudden, you have the worst diarrhea that you've ever had in your life. And you're like, wow, this is bad. And you call me and say, oh, you know what, you better keep taking those antibiotics because that infection got into your guts. So you keep taking it, and the diarrhea just gets worse. 3 days into this, you're like, okay, I'm getting lightheaded now. I'm having the worst diarrhea of my life. What you've developed is C. diff. And what C. diff is doing is creating a toxin that is killing off the lining of your gut. And it's giving you diarrhea because you can no longer control the fluid balance from the in between your cells and the lumen or center of your gut. 1 dose of antibiotics is sufficient to do it, and I can tell you we can prove that because we have a case study of a patient who got 1 dose of Cipro for a prophylaxis for a surgery, and 3 days later developed C. diff so bad that he ended up having his gut removed, his intestine removed. I want to take a pause here for a second to tell you one of the things that one of my favorite teachers, Dr. Kaku, used to tell me, and she used to say, Matt, I want to ask you a question. What does antibiotic mean? And I said, well, what do you mean? It's a medication that fights infection. And she said, no. Go back to the Latin parts of this word. Anti, and I said, well, that means against, or in opposition to. And she goes, bio, and I said, that means life. And she goes, now say those 2 things together. Antibiotic against life. I was like, oh, well then. You're taking that into your body, okay? Antibiotics are great things. I didn't come up here tonight to tell you that you should stay away from all antibiotics, okay? That's not, But it's like any good weapon. It's like having a gun in your house and pointing that gun at everybody that comes to your door. You're going to scare the pizza man. You're going to scare the Girl Scouts. And you're going to do a lot of damage. You want to keep it for when the burglar comes. Okay? Antibiotics are the same thing. Remember, anything that you take into your body, and a lot of people ask me, well, why are antibiotics? What do you mean? Antibiotics come from chemicals that fungus make to kill bacteria when they're competing in nature. Okay? Penicillin is derived from fungus that is used, that the fungus creates to fight bacteria when they compete for nutrients in nature. It's chemical warfare. And your body is the war zone. So that's like spraying napalm all over your body. Those antibiotics do damage your cells if you take them long enough. And if anyone's taken antibiotics for long enough, it can cause kidney problems and liver problems and all kind of things. So you have to use it judiciously. Okay? When you don't, it's like shooting that gun all around. The next one is, and this is when it's going to get really controversial, so feel free to just ball up the papers and get ready to throw them at me. Santa Claus is being diagnosed with Lyme disease again. Darn reindeer. Myth number 12. If you've been bitten by a tick, you have Lyme disease. That's not true. Okay? If this were 10 years ago, I would tell you almost with complete certainty that you didn't have Lyme disease. Lyme disease is not named for a person who described it, but actually where it was first noted. And it is a rickettsial illness, which is a type of bacteria that we first noted in West Virginia maybe 5 or 6 years ago in significant numbers. Okay? Before that, you had to live in Pennsylvania or Connecticut. Definitely Connecticut. Okay? New Hampshire, New York. But in the recent years, it's become this hot topic because if you don't know what's wrong with you, we're going to blame it on Lyme disease. And it's become this huge area of conflict between groups of physicians, patients and physicians, patient rights advocacy groups and physicians, basically everybody versus me. Okay? Not all ticks carry Lyme disease, and the bacteria that causes it, Borrelia burgdorferi. And not all bug-carrying ticks transmit Lyme disease. Okay? The ticks that carry Lyme disease are very small. And not only are they small, but the phase that carries them is an immature phase called the nymph phase. They're almost impossible to see with the naked eye running around. Okay? In most cases, the tick must be attached for 36 to 48 hours before the Lyme disease can be transmitted. So if you find a tick on you and it's crawling around and you pull it off, odds are it didn't give you Lyme disease. Okay? If you find one and it's attached and it's not engorged and hasn't had a blood meal, odds are it didn't give you Lyme disease. And even if it did do all these things, there's no guarantee that it was one that had Lyme disease. Now, obviously, people get Lyme disease, and who better would know that than me who treats it, okay? It does exist. It does exist in the state of West Virginia, okay? But not everybody that's tired has Lyme disease. Not everyone that has joint pain has Lyme disease, okay? No one's thrown anything at me yet, so we'll keep going. I want that guy tested for Lyme disease, okay? The next one is that the tests for Lyme disease are usually wrong. Now here's where things get hairy. About 6 years ago, 2 groups of physicians went to war. And I say that not all joking aside. It was a legal battle that went all the way to the Supreme Court. One group was the Infectious Disease Society of America, physicians like me who are board certified in internal medicine and infectious disease. And the other group was called the Lyme Literate Doctors of America. Okay? It was one of the biggest medical controversies that had ever hit infectious disease. And what the Lyme Literate Doctors of America said was that IDSA was not providing good care to people with Lyme disease. because IDSA released guidelines on Lyme disease saying, here are the guidelines that you need to have. This is what your doctor needs to find in your bloodstream in order to say that you have Lyme disease. And the reason that they did that is because the physicians were saying, oh, if you have a fever and a rash and joint pain, you have Lyme disease. And all of a sudden there were tons of people getting a medication called doxycycline. And then there were people getting Rocephin and getting PICC lines and getting tons and tons and tons of antibiotics, okay? And then people started dying from the treatment for Lyme disease. Because if you have a PICC line in and you keep it in for a year and your bloodstream gets infected from a bacteria that colonized that and then caused an infection, then we've done the first thing that doctors are not supposed to do, which is the first part of the Hippocratic Oath, which is first do no harm. Okay? That is one of the, so it went all the way to the Supreme Court, and the Supreme Court made the Infectious Disease Society of America repeat studies, multiple studies on people with symptoms of Lyme disease, retest them, retreat them, prove that people didn't get better with more antibiotics. So there's this whole group of people who got retreated, who didn't get better, and it came up with this term, post-treatment Lyme syndrome. Okay? So in the argument of all this, one of the things that got brought up was testing. And the fact that the Lyme literate doctors of America test any fluid that they can find in your body. They'll take a little piece of the connective tissue from your knee, they'll take your brain fluid, they'll take blood, they'll take muscle biopsies, anything. IDSA said, wait. We can't find enough people with all these different things that have consistent lab findings. So then the Lyme literate doctors fired back, well, that's seronegative Lyme disease. And that's when my head spun off my shoulders. That's like saying that person that's not sitting in that chair right there, they have chest pain. What? You're talking about a disease that you can't describe, with a test you can't replicate, with a treatment that does no good. So why would you diagnose people with a disease and say you have a lifelong debilitating disease that we can't test for, that we can't treat, and we don't even really know how to define it? And I will tell you, one of the points that was brought up in this court case is the Infectious Disease Society of America proved that there's been one death attributed to Lyme disease that was clinically proven. There have been hundreds, if not thousands, of deaths of complications of antibiotics from it. Have you ever heard the phrase, if the cure's worse than the disease? Okay.
I have a question.
Yes.
Your myth back there said that the tests are generally wrong. That was the myth.
That is correct.
So you're saying that tests then done correctly are generally right.
Correct. If you get bitten by a tick and you go to your doctor the next day and get the test, it will be negative because it's an antibody test that requires your body to produce a protein in response. Okay? It takes about 2 to 4 weeks. So if you get bit by a tick, don't run to your doctor the next day because they're going to be like, I don't know. Well, I mean, you can, and they may give you an antibiotic. But about 4 to 6 weeks after the bite is when you need to do this. Okay? At that time, the sensitivity of these tests is very good. And the specificity is pretty good. Sensitivity in medicine means that if you have it, we'll find it. Specificity means if you don't have it, we won't find it, okay? It's kind of a backward thought, like how would you find it if it wasn't there? But false positives, a test that says when something's there and when it's not, okay? Specificity is harder to get in a test because if you want to be really sensitive and get all the good cases, you have to be able to accept a couple of the false positives. You're welcome. In response, the Lyme literate doctors of America funded this movie, Under Our Skin. Have any of you seen this movie? This is propaganda at its best. This is a video of people who have very poorly defined, debilitating neurological diseases without testing that's positive for Lyme disease under the guidelines that IDSA had produced, which, by the way, the Supreme Court upheld through independent review. And I watched this movie and I was upset after watching it. These people are suffering. There's something definitely wrong with them. They've gotten a bunch of antibiotics that they didn't get better from. They got a bunch of tests which really didn't prove anything, and they're being told you have this disease that you're gonna have to take antibiotics for the rest of your life that's not gonna improve it. Why would you do that? What do you gain from that? Again, it's like telling somebody you have a disease that we can't do anything about, but we're gonna give it a name, and we're gonna tell you we're gonna do something about it that's not gonna make you better, but you have to do that. I don't know about the rest of you, but when I go to the car dealership to get my oil changed, I don't say, change my oil, and he goes, well, we're gonna change the interior of your car. We're gonna change the leather. And I'm like, but there's nothing wrong with the leather. Well, it's got a little ding here and there. Well, we're gonna do it, and we're gonna do it every time you come in, and it's not gonna change the value of your car, but we're gonna do it, and it's not gonna help you at all, but there's something we're gonna do, it's gonna cause you great distress and discomfort. People always ask me, should I watch this movie? And I tell them, you have to watch it the way a doctor would watch it. And that means you have to ask yourself questions. You'd have to say, could something else be causing this? What could we do for these people? And is this even really Lyme disease? And that brings you to the next one, which is you need a long series of antibiotics to treat Lyme disease. I had a 24-year-old girl come to my office one time, and she had been on antibiotics for 2 years by a PICC line. She had been in the hospital 4 times from bloodstream infections from the antibiotic. She had gone into kidney failure once, and her liver was irritated from the antibiotics. She ended up having cardiac surgery to replace one of the valves in her heart because it had become infected from an infection that she got through her PICC line. Do you know what the first thing she told me was? When can I restart my antibiotics for my Lyme disease? I'm like, honey, you just had open heart surgery. Your Lyme disease is not your big problem right now. She said, I need it. I will die without this antibiotic. I said, honey, you almost just died right here. That's the problem. There are very well-defined courses of regimens of antibiotics for Lyme disease. There are 2 medications that are clinically proven by Infectious Disease Society of America standards that treat Lyme disease. One is doxycycline, which is a pill, and the other is Rocephin. The longest course of treatment that is guaranteed to produce a change is 4 weeks of Rocephin. Okay? There's none of this, I'm gonna take 6 weeks of antibiotics and then I'm gonna take 6 more weeks. Then I'm gonna take another month, okay? That doesn't work, it's not proven to work, okay? So even if you end up with someone diagnosing you Lyme disease, please, if you do your antibiotics and they say, we wanna do another 6 weeks, call somebody. It doesn't have to be me. I would prefer that it would be me, but call somebody. Be informed consumers, okay? This actually went through the streets of San Diego. IDSA rejects science, denies care. And this actually was by the Lyme literate doctors of America. This is slander. This is libel. It's in writing. There were actually infectious disease doctors who lost their jobs and their practices because they were sued by patients saying, you didn't treat me the way that this doctor said to treat me, and I got sick. And those doctors were following guidelines. So Lyme disease is a very touchy subject for infectious disease doctors. And it's because things like this is dangerous propaganda. Okay? And that myth 15, chronic Lyme disease. Now, I'm going to take my biggest step out of being politically correct and tell you that this doesn't exist. And there's going to be at least one person in this audience that's going to disagree with me. And I'm going to define it better for you and explain to you why. Chronic Lyme disease would mean that you were not ever treated and you've had Lyme disease for greater than 3 years and it's causing you symptoms. If you got treated, you no longer have Lyme disease. If you have a pneumonia and they grow strep out of your blood and they give you antibiotics, the next time you get pneumonia, do you say, that darn chronic strep pneumonia? You can only kill bacteria once, okay? Doxycycline kills Lyme disease. It's gone, it's dead, okay? 1 in 5 patients develop a post-Lyme treatment syndrome, which includes fatigue, muscle pain, joint pain, maybe some fevers. Almost every person that has chronic Lyme disease has these symptoms. IDSA created this phrase to explain to people what happens to your body after you've had an infection with Lyme disease and got treated. How I explain this to patients is, if you have a heart attack, afterwards your heart is weaker. When you climb up a stairs and you're still short of breath, you don't say, I'm still having a heart attack. No, the damage is done. Your body is changed by it, and you're no longer able to function the way you were, but that doesn't mean you still are having a heart attack, okay? It's a distinction that we need to make. Symptoms do not always equal disease. The concept of chronic Lyme is not accepted by the Infectious Disease Society community. It doesn't. Now, Lyme literate doctors will tell you that, and they'll tell you seronegative Lyme disease, and they'll tell you all these other things. I always encourage people, I say medicine is an art, it's not a science. If your answer is out there, if your truth is different than my truth, that's good, go find it. But have your doctor or nurse practitioner or whoever explain to you why they're doing what they're doing. I always tell my patients, here are the guidelines that are set out for me by people who are smarter than me, who have done studies. I follow them because if I follow them, I will get the same results every time. I don't just pick antibiotics willy-nilly, throw some vitamins in here and do things like that. You follow science because you want something to be reproducible. If I give you 7 antibiotics and you get better, but I give you 7 antibiotics and you don't get better, and then I give her 7 antibiotics and she doesn't get better, I don't keep giving everybody 7 antibiotics just because it worked in one person. It's called anecdotal medicine. It's also called old wives' tales. Okay? So that is the big myths and infectious disease around this community. I realize that what I've said is a lot, but hopefully it makes sense. Thank you all very much for your time. I appreciate being asked to speak.